Dr. Sean Price, Clinical Coordinator here at The Fix in Fort Walton Beach, and I'm doing this series on blood sugar metabolism, and the effects that it has on the body if it's gone awry. In the last video we talked about how if you have this kind of a pattern as you eat, if you're having highs and lows in your blood glucose levels and everything, even if your lab values appear to be normal, but you're still having these physiological responses, how detrimental that can be to the body. One of the main ways that it is majorly detrimental is because it causes inflammation in the system. And over this series of videos, we're going to talk about the different effects that inflammation has. But it's very, very important to understand that when you have this inflammation, one of the first things that happens, or one of the effects of that, is your blood-brain barrier can actually become hyperpermeable. And that allows things to cross that shouldn't be there. When that happens, you get these inflammatory responses into the brain area of the body, and you start getting brain inflammation. You'll start having short-term memory loss. You'll start having all these different mental challenges, loss of coordination if it hits the cerebellum, loss of proprioception if it hits the parietal lobe. So all these different areas can start to be affected. That's on the brain. Another theory is that when your blood sugar is off like that, and when you have inflammatory responses in the body, that the blood itself can actually become pro-inflammatory. This will cause your cholesterol levels to rise, because when you have increased damage to arterial linings because of inflammatory responses in the blood, then the body releases cholesterol to protect the arterial lining. That's actually a protective mechanism. We see it day in and day out in this office when we help patients get their blood sugar under control, and there's a series of things that you have to do to get that to happen. When you get this blood sugar under control, cholesterol drops 20, 30, 40, 50 points. We've seen patients drop 60 points in a matter of 90 days without medication, without anything except for getting the blood sugar under control. So that's a huge factor. Inflammation also affects your digestive tract and your gut lining, which I'm going to do an entire video series, or a video on in this series. So this inflammation is very, very detrimental to the body. It's going to affect so many aspects. So that's the key. Remember, it's not just about blood sugar. It's not just about going and getting an insulin shot if you become diabetic. It's not, or metformin, or whatever the medication is. It's not about that. It's about how your body functions. And blood sugar causing this inflammation is a deal breaker. If you don't fix the blood sugar, your body will be very, very difficult to heal. All right, so in the next video, we're going to get more specific with the effects this has on you. So the inflammation is very, very detrimental. In the next few videos, I'm going to go into very specific parts of the body and how this inflammation affects those. Now, if you have any other questions about this, please feel free to post below. If there are other topics that you'd like me to cover, please feel free to post that below as well. I look forward to the interaction, and I look forward to hearing from you. All right, we'll see you on the next video.